We are going to begin by reviewing what primary progressive aphasia is. PPA is the number one type of dementia impacting those who are 65 years and younger. PPA is caused by degeneration of the frontal and temporal lobes of the left side of the brain. What that means is that these are the areas of the brain which are responsible for language. This is why individuals with PPA typically present with symptoms of gradual aphasia, which means difficulty with language. Common symptoms include slow speech, trouble with pronunciation, and poor grammar. These symptoms are gradual and they get worse as time goes on. There are 3 different variants of PPA. The first is the non-fluent agrammatic variant. In this variant, there is a difficulty with word order and word production. The next variant is the semantic variant, which is an increasing difficulty with naming people, objects, facts, and words. Individuals with this variant struggle with word understanding. And lastly is the logopenic variant, which is a problem with phonemes, otherwise known as pronouncing words. So it's important to know that depending on which variant your loved one has, they are going to present with different symptoms. Because this is a degenerative language disorder, symptoms for the person will be different at different stages of the progression of their PPA. Mild symptoms are often so slight that they are missed or just blamed on regular aging. These include difficulty with word finding, reading or writing, slowed speech, or just trouble comprehending conversations. Once you enter the moderate stages of this disorder, you're going to have all of those mild symptoms elevated. And you're also going to start to see a possible change in personality. This is because the individual is frustrated. They're not able to communicate with you in the same way that they once were for years, and the brain activity is just working differently. So when they're talking to you and they become frustrated, please know that this is not the result of anything that you are doing. Once you enter the severe stages of this disorder, unfortunately, there can be a complete loss of language or just limited ability to use language. This is when you as a caretaker are going to have to get creative with how you understand the individual who has PPA. Knowing all of these things, you might be wondering how you can help at home. Speech-language therapy activities that can be carried over at home with the help of a caretaker are extremely useful. The first treatment approach we're going to talk about is the verb network strengthening treatment, otherwise known as VNEST. VNEST is a verb-centered treatment approach designed to strengthen the ability to create sentences in spontaneous conversation. So you're going to notice that sometimes an individual with PPA is talking and all of a sudden they're going to halt on their speech because they can't think of a specific word that they would like to say. This can result in them not wanting to talk at all in some cases. So VNEST really aims to increase spoken and written word retrieval in conversational discourse. This treatment approach is based on the connection between verbs and their thematic roles. So what happens is the client creates a structured sentence with a verb that you or the SLP present to them. This is first done by identifying the who and the what, and then it can be expanded to identifying the when, the where, and the why. Depending on this level of severity, this might change. But the important thing is that you are the one providing the verb, and then they are the one providing the rest of the sentence. We don't want to use photos with this treatment because we want the person to make their own connections in their mind so that they can create their sentences later on. A 2014 study evaluating the effectiveness of VNEST treatment found that there was significant improvement on both trained and untrained verbs in individuals with aphasia. So it's proven that this is a great treatment. It can be conducted at home, as mentioned, as long as the SLP trains you prior to this. However, it is a multi-step process, so utilizing a computerized app such as Tactus Therapy is great because it takes you through the process step by step. It has also been found that computerized VNEST is just as successful as utilizing it with note cards, as seen in the video on the QR code, which demonstrates myself and another SLP graduate student going through the process of following VNEST. We suggest that you watch it so that you can get an idea of how this treatment approach works. The next speech therapy approach that can be utilized by caretakers to assist their loved ones is creating visual support systems. Visual support systems can be anything from communication books to menu boards to yes/no answers to identification cards that are primarily created in mild sets of primary progressive aphasia. They can really be anything. The great thing is there is no right or wrong formatting. However, it's essential to create these with the assistance of an SLP because you want to make sure the communication deficits are being met properly. The important thing to remember is that what works one week for primary progressive aphasia might not work the next week when it comes to communication. This is primarily because of the progressive nature of this disorder. Remember that you want to keep phrases short and direct or utilize imaging just to make it easier for your loved one to communicate. These books are great for stimulating conversations and making it easier for the person to communicate effectively without hesitation. The QR code attached has a variety of ways that the individual can create visual support systems at different stages of their primary progressive aphasia with your help. Now we're going to transition to talking about communication strategies for caretakers. The first is setting the scene for clear communication. When speaking to an individual who has PPA, attempt to communicate in quiet places that have limited distractions. Allow for extra communication time, and try to eliminate stress and frustration, as it does not help. Use simple and direct sentences, but do not dumb sentences down. You can do this by speaking slowly, clearly, and in short, direct phrases. If there are barriers to understanding, get creative with it. Use pictures, written words, whatever's going to help so that you understand the message that they are trying to share. You can do this also by using high-frequency words. These are words that are commonly used in conversations. Think about the word give versus the word donate. The word give is something that we would primarily use more of, therefore it might be a simpler word for those with primary progressive aphasia. And additionally, and possibly above all else, just keep it positive. The person knows that they are communicating in a limited way, so you don't want to correct them, you just want to work to clarify and understand their message. Keep the dialogue moving, try not to judge them, and know that adaptability is key. Again, what worked yesterday might not work for today. Follow the lead of the individual who has PPA to see what helps them most. And above all else, treat the person like the adult they are. They deserve respect, and everything that you share should be kept age appropriate. Additional communication tips can be found on the Association for Frontotemporal Degeneration's website with a QR code that is attached. Please know that additional caretaker resources are available. The AFTD helpline is available 24/7 to answer any questions. Additionally, counseling is always a helpful tool, especially if you're used to communicating with someone one way for many, many years. It's hard when there's a breakdown in communication. Things that might have not been your roles and responsibilities before now become those, and that's a hard process. It's okay to ask for help. You can do this via a support group, there's online platforms, there's web-page platforms, and there's in-person platforms. And additionally, legal and financial advice is available to you. It's best that you reach out to your primary speech-language pathologist to find out more about the resources available to you. Thank you so much for watching this presentation about caretaker communication tip guides for those with PPA.